I'm going to be very strict with the 5-minute rule, as we have moved way past our time here and we need to move on. So with that, I look forward to the next round of questions so we can get to the essential work of addressing this pandemic, which has upended so many lives and that continues to threaten the public health. And we will begin with Senator Baldwin.
Thank you, Madam Chair. Dr. Walensky, during our last hearing, we discussed the critical need for my Biopreparedness Workforce Act legislation that I introduced with Senators Collin, Rose, and Murkowski to strengthen our outbreak response workforce so that we can better prepare for the next pandemic. This legislation would address the serious workforce shortages and recruitment challenges that you mentioned by establishing a new loan repayment program focused on encouraging students to pursue careers as clinicians and biopreparedness health professionals. As this committee assembles a package of policies to respond to the next pandemic, it's important to remember that without people, there is no preparedness. In the midst of the Omicron surge, it has never been clearer that we need a robust and capable workforce to fully respond to public health emergencies. The Biopreparedness Workforce Act would go a long way towards that goal. So Dr. Walensky, as an infectious disease physician and public health leader, can you share more about how a strong clinical and public health workforce is key to responding to outbreaks and how legislation like the Biopreparedness Workforce Act is important to prepare for the future, public health emergencies?
Yes, thank you, Senator. There's so much here. So first, let me just say, there's been a recent study that has demonstrated that our public health workforce is now down about 80,000 jobs. So just to give you a sense, and that's public health workforce, that's not physicians who are actually doing the work on the ground, right, in the hospitals. This is a public health workforce down 80,000 jobs. We saw through this pandemic the challenges in sort of the volume of people who were doing public health work, but also where they were located and their experience. We need an upskilled public health workforce. For example, we need people to do those genomic sequences. We need genomic epidemiologists. We need people who are diverse as the communities they serve. We also need to make sure that they are compensated, have the right salaries, and as you say, have loan repayment for their work. To give folks a sense, the infectious disease physicians are among the lowest paying physicians in hospitals. They don't do procedures, and by virtue of not doing procedures, there's not a large incentive from a financial standpoint to continue to go into infectious diseases, which are the bread and butter of what outbreak investigation and clinical it does. So there have been many resources that we're moving forward to expand our public health workforce. Public Health AmeriCorps is a big piece of that, and that is something that we're working on and really grateful to resources from Congress to be able to do so. But there's a vital need now to expand our public health workforce in laboratory capacity, in genomic surveillance, in disease outbreak investigation, and a workforce that is upskilled and as diverse as the communities we serve. Thank you.
Thank you. We all know that vaccines remain the best way to protect yourself against existing variants of COVID-19. And I've been encouraged by the FDA's work to authorize vaccines for the public, but parents continue to be concerned that we don't have a vaccine for their kids as Omicron surges. Dr. Woodcock, can you provide an update on where we are in examination of the authorization of COVID-19 vaccines for children under 5?
Certainly. As Dr. Fauci said earlier, they were one of the companies, Pfizer, had done trials. There were other trials going on. There were probably complications with the dose in the slightly older of the younger children, perhaps indicating that a third dose, as Dr. Fauci said, might be needed to the primary regimen. FDA is working with the company very closely. Trials are ongoing. I, too, have heard from many, many parents of the youngest children. They have other children in school. They may have immunocompromised individuals in their household, and there are people who really want to get this vaccine. So, one of the vaccines, and get the children vaccinated. So we are working very intensely on this right now, and we're working, of course, with NIH and with the companies.
Thank you. I yield back.
Thank you. Senator Paul.